Welcome back to Houston Life. If you're struggling with daily back pain, you're not alone. Listen to this statistic. 80% of the population will experience some sort of back pain in their lifetime.
That does not surprise me at all, by the way. And chronic pain affects more Americans than the number affected by diabetes, depression, and high blood pressure. According to a recent study by the National Institutes of Health, that is where those numbers come from. And joining us now with a look at the different treatment options to manage back pain is Dr. James Showery, an orthopedic surgeon affiliated with Memorial Hermann and Rockets Orthopedic Hospital. Welcome to the show.
Thank you for having me.
As Tessa just said during break, happy Valentine's Day.
That's right.
Is coming up. But this is a serious issue for a lot of people.
Truly.
We're not necessarily talking about back injuries. Back pain can come from even just simple strain, and that's why the numbers are so high, right?
Yeah, that's a great point. Like you said, nearly everyone experiences some back pain at some point in time in their life. And maybe my message here today is that, on keeping theme with the whole episode today, is I want to teach you to love your spine, right? Just like a healthy relationship hurts every once in a while, your back, a healthy spine, can also have a little bit of pain every once in a while. And that's okay. That's sort of a normal part of life. And there's a lot of things that we can do to kind of help prevent that from becoming something that really interferes with your quality of life, really interferes with your daily activities.
Yeah, we're looking at general causes of back pain. I mean, strains, fractures, spine arthritis, herniated discs, and I've heard these heavy lifting with improper posture. I mean, we all have to go out and live our lives, right? But some of this could really be doing a number on our spines.
Yeah, that's true. Ultimately, we all have to do normal activities of daily life. That means picking something up off the ground, or picking up our kids, or even going to an airport, picking up your luggage and putting it in the overhead compartment. It's really common for me to see someone who might have had an episode of pain that was started by something that was sort of innocuous, like not a big lifting episode, or just turning wrong might have triggered it. And I think that the way I think about a lot of that is that that's a loss of stability in their spine, that they were doing something that triggered that pain because they didn't have sufficient core strength to hold their spine in a proper position while they were doing that activity. And I think that kind of ties into the underlying pieces that really help prevent it, which is maintaining good core function, maintaining good posture, and maintaining that position of strength through all of your activities that you're doing.
That's a really interesting point, because I've heard for years, and tell me if this is true, that simply just getting out and walking can help improve your back strength to help prevent injury. Is that true?
Absolutely. I mean, the activity we know is good. So the more activity you're doing, especially in someone who's had chronic pain for a long time, just getting outside, getting some sunlight, going for a walk is very important for just your overall health, right? And that's sort of the foundation of the overall health, which then transitions into the spine. I think about the spine, and I brought this model here today.
That's a great prop.
Demonstrate it. The spine is many bones stacked on top of each other, and they're all connected with these little discs. And these discs are like a fabric connection with a jelly inside of it. They're sort of a shock absorber. What you're not seeing on this model is all of the muscles that are connecting and all the tissues and stuff that are connecting in between it. In order for you to move and get up and walk, you have to have your spine stabilized, right? So you go from a position where it'll flex or extend to pick things up off the ground to turn. But when you want to walk, you want to have an efficient transfer of energy as you're moving, you need to be able to engage the muscles in your spine to hold it in a good position while you move. And I think that's kind of the big piece here that can be very helpful for improving some of these issues.
Right. And how are you diagnosing someone that's saying this person has chronic back pain? How are you doing that?
Yeah, I mean, mostly that's based on history. So, people who have a spine deformity, for example, maybe their spine is so degenerative that they've developed a scoliosis curvature over time, and they're having pain from that or from the arthritis in the joints. A lot of times there's things like physical therapy, sometimes injections from the pain management side of things, sometimes some medications to kind of help them get through that. And then ultimately physical therapy, really focusing on identifying those pain triggers and finding ways to improve those symptoms. In the rare situations where someone might need a surgery, that's typically for neurologic problems, having significant weakness or having problems with balance or things like that, where the spinal cord or one of the nerves is getting significant pressure and not functioning correctly.
This is something we were, again, chatting during the break. I am such a believer in physical therapy. I've been in therapy for my back since high school because I've thrown it out many times. I'm such a believer. Again, how does someone know when their back pain is at a point where it should be diagnosed as chronic or where they should be seeing a physical therapist? And what are some of the, I mean, you mentioned treatment options now, but can people just call you and say, hey, my back has been messed up for a while, I need to figure out what's going on?
Yeah, absolutely. There's a lot of different routes to get care for something like this. So, one of the great things that happened in 2019 in Texas, you're actually allowed to have direct access to physical therapy, meaning most insurance companies will allow you to see a physical therapist and see them for, I think it's 10 or 15 days prior to getting a referral from a physician. So you may not even have to see your doctor first. You can go directly to physical therapist. Memorial Hermann Physical Therapy has excellent facilities all over the city. It's a great way to kind of get any access there. Typically, they'll screen and kind of do some things. If the therapist you're working with identifies some issues that maybe need to see a doctor for, they'll then refer you to someone like me or maybe one of the primary care doctors within their system or even one of the sports medicine doctors who might be able to help.
Yeah.
Well, and we have some of the best care in the world.
Yes.
Do not live another day in pain. Dr. James Showery, thank you so much for stopping by.
Absolutely.
I
Thanks
still
for
have a
having me.
million questions for you. We're out of time. Come back and see us anytime.
Yes, yes.
In the meantime, to our viewers, if you'd like more info on back and spine pain, visit this website, memorialhermann.org/orthospine, or you can call 713-314-4453.